the journey I found myself on about 25 or 30 years ago, which was everything that I didn't learn in dental school. It turns out a lot of this holistic based medical dental awareness seem to be European based. They seem to be way ahead of us. They don't think the way we do. They're not so pharmaceuticalized. They think about the body as a unit. And it sounds, your references Polish and German. You didn't mention United States or, you know, I know we all speak English, but is that, right. Do you share that concept? Is the genesis for a lot of this being more European based rather than Western world based? You know what I mean?
I mean, Western Europe versus United States.
North America, yeah.
Right. Yeah, we like quick things. We like medications. We like things that bring about quick results, which is wonderful. But nobody thinks about the side effects and all kinds of complications that come about later.
Right.
Autogenic training it came out of neurology. So I know there are many meditative techniques that came out of Eastern cultures that are beautiful, absolutely beautiful. And some of them have been packaged and you can watch them on YouTube, etc. It's lovely. And they do perhaps similar things. Autogenic came out of neurology, like how does the brain regulate these functions? It came out of that. And it's actually taught in medical schools. So no, I think Germany was ahead of everyone else. Right now, the country that is like a sponge in Europe that absorbs good things from different parts of Europe and kind of packages them is England. So autogenic training is actually huge in England. I just gave a lecture to them 2 weeks ago to the British Autogenic Society.
Good, thank you.
Autogenic training has the potential to make a difference in creating sleep. For those patients who are hypervigilant, what is the success rate of autogenic training in hypervigilant patients to get them to the point where they can enter into stage into sleep and not be hypervigilant when they're asleep?
Yes, so autogenic training is a natural state basically. So it will facilitate sleep or moves you towards sleep. But its main function is actually normalization. So normalization both in terms of our physiology and also in terms of our psychological states. So let's take a look at the term hypervigilance. Hypervigilance is basically an anxiety state in which people are excessively alert, expecting, anticipating something bad to happen to them. Hypervigilant, watching, excessive watching. So when we are dealing with anxiety, something is going to happen to me. We move from vigilance, being watchful, what is that, etc., to hypervigilance. And then the next step would be a much more complex and complicated state. So the first thing to do is I would, when I see hypervigilance, I think the most important thing to do is not to do autogenic training, but actually discover the source of hypervigilance, which is anxiety, fear of the unknown. Talk about, make the unknown known, then hypervigilance begins to calm down. So it's an anxiety state. Now, if this is, I don't know, I just have a tendency to be hypervigilant, etc., then we can regulate that. Once we rule out that it has nothing to do with immediate environmental factors, then we can begin to normalize that. And autogenic training can help with that process. In time, one of the advanced autogenic exercises has to do with autogenic neutralization, in which we use these techniques to actually directly go after hypervigilance. What is it? Where does it come from? Etc. Remember, we are working with the physiology. So hypervigilant person has excess activity in the sympathetic adrenal medulla axis and excessive activity in the limbic pituitary adrenal cortex. So there are two sets of biochemicals that are elevated, catecholamines and glucocorticoids, both of which will have unfortunate ramifications when it comes to it. When people are hypervigilant, they have elevated norepinephrine levels, for example, elevated glucocorticoid levels, both of which will, number one, tax the cardiovascular system, and secondly, the musculoskeletal system through elevated cortisol production. So that needs to be addressed. And one is to kind of figure out when it started, how it started. Are there specific things that make a person hypervigilant? And delve into that and then take the person through autogenic state.
So what you're really telling me, or I think you're telling me, is Micah, if you have a patient who is sharing with you that they're hypervigilant and you see that they're hypervigilant, and anxiety would be the first step in the normalization process.
Yes.
And of course, treating anxiety is certainly well beyond our scope of practice. And so that's the time when, if you've done your homework and you have a relationship with a psychologist, that you would say to the psychologist is that I sense that this person is hypervigilant and needs your expertise and input in the anxiety management, which then in turn sets that patient up to becoming more self-regulated once they start autogenic training.
Absolutely.
So if you're really lucky, you have a really good psychologist who has autogenic skill sets.
Yes.
You send that patient to Pennsylvania.
I do, but so it's the I think the first step is for me. So let me define anxiety. Anxiety is a fear of the unknown. So unknown makes me like, what's behind that door? My door is closed to my office, and I'm not conjuring up what could be there. So I'm anxious that there's something there. Now, all of a sudden, I'm noticing there's a noise on this side of my office, and then there's another noise on the other side, etc. Now I'm watching. There's an unknown. So hypervigilance is an expression of exposure to excessive unknowns. So when you, Dr. Jones, when you say to your patient, we're going to do the following things. I'm going to do this procedure number 1, procedure number 2, etc. So as you make the unknown known, hypervigilance goes down. So it's hypervigilant person is someone whose life is filled with a lot of unknowns, which requires them to be excessively alert so that just in case something bad happens, which will drain them, basically. Hypervigilance will drain you. You can't be alert about every noise, every sound, every gesture, every email, etc. So it's building up resources that push in. And you do play an important role in that healing process. The way you talk to them, and also when you make the unknown knowable.
Do asthmatics have sleep disturbances because of what asthma does to the airway?
Yes, in fact, if they kind of connect to Dr. Jones's question, especially if they develop an anxiety disorder related to the asthma. So there's this fear that not directly the asthma, but that what if I'm not breathing properly?
Right.
Again, I need to be aware that the fourth autogenic exercise will actually teach you that breathing, even though we control breathing, that breathing is an autonomic process. The part of your brain that knows how to breathe, it knows how to breathe properly. So the German for that phrase, which we translated into English, is "Es atmet mich." It breathes me. The breathing is not something that I do. the brain does the breathing. Extremely helpful for people with panic disorder, but also with when it comes to asthma, I'm more concerned about the anxiety related to asthma, that somehow I'm not going to properly. Your brain is programmed for survival, so your brain knows how to, as long as we do not interfere with it. So you can teach them that they can learn proper breathing, and also trusting that the brain does proper breathing, and as long as you do not interfere with its function. Um, there's a medical interventions when it comes to asthma in terms of inflammatory and spastic causes for it. That can be medicated, but it's the anxiety related to asthma that interferes with sleep oftentimes.
Right.
Particularly when you have nocturnal panics, which happen in slow wave sleep during the first 2 cycles. Extremely difficult to treat with medication, etc. I've had excellent success with autogenic training. Nocturnal panic, very, very difficult.
Good, thank you. Second question, do you use Buteyko breathing techniques and scripts like in Reverie or Yoga Nidra?
I've heard of those approaches. Yoga, autogenic training is not yoga. It sometimes they achieve similar hypometabolic states. The purpose of yoga, all its variations, is, and I know very little about, but for my book, I've studied 7 general forms of yoga, and Nidra was not one of them. But the purpose of yoga is to bring about mind-body unity. Its purpose is not to relax you. It's a much higher purpose to it. I don't recommend combining autogenic with yoga. That would not be a good idea. Doing them at different times. Autogenic is a very specific psychophysiological technique. Its job is to promote repair, whereas yoga does so many other things. There's a profound spiritual component to it. I hope I heard the question properly, but it's not really a form of yoga. It may seem that way. It's not. It's an intervention. It's a therapeutic intervention.
Is employing the quote-unquote psychological sigh just one of the many breathing techniques, or are there others that trigger the vagus nerve to release acetylcholine, which results in relaxation?
Now, this actually goes right hand in hand with what I was describing. And I really appreciate the question, so thank you for that. We often think about on and off switches, which we can stimulate different nerves, and they do different things and promote acetylcholine or increase norepinephrine, etc. So, if you don't mind, I suggest instead of on and off switches that you think in terms of multiple knobs that are interrelated. So if you don't think about one thing, but the interaction between these different knobs, not just an on and off, but turning them in one direction versus the other. Let me tell you why this is important, because if I were to flip one of those switches, and let's say there's a significant drop in your blood pressure, and it's wonderful, and your heart rate drops, that could also be incredibly dangerous if you were to stand up very quickly. So the body knows how to turn those switches, those knobs down in a gradual but purposeful way, and how to reverse the process. It's not one thing, it's multiple circuits at work. And it gradually changes those things. For example, the first system we see that responds to this is musculoskeletal system, calms down, and then there's an increase in blood flow, etc. You are seeing changes in various areas of the nervous system, but in a methodical, not forced, methodical, integrated fashion. I think that's the concept we need to emphasize, that the body has an unbelievable wisdom. It knows how to regulate these things. If you allow it to do those processes in a methodical, systematic. I trust that versus forcing something, even though it may be a wonderful, helpful thing. Years ago, very quickly here in our wonderful country, people were promoting this technique to, if you're upset, just if you attended these groups that people yelled out their emotions, just screamed out, and they felt so much better. So just force it out, just get it out of your system. Wonderful technique. Then they discovered that people had cardiac problems with that technique and blood pressure and stroke, etc. So if the body is ready to release tensions of that sort, it sets the stage for that to happen versus just flooding it with certain emotions, whether positive or negative. I hope it makes sense. I trust the systematic, brain-directed, which is the autogenic, brain-directed process where it regulates those systems. A very methodical, gradual, not on and off switch, but the switch between sympathetic and parasympathetic is a very methodical, gradual process. If you force it, being in a parasympathetic state could be a very dangerous one. You see it with beta blockers. When you put a person on beta blocker and they have orthostatic hypotension, they fall and break their hips or something like that. So,
right.
So it's a gradual shift.